what are your recommendations for policymakers, for technology people who are trying to get into the space and who are trying to figure out ways of solving these problems?
I think it needs to be understood as an issue first and foremost. I think, you know, there's so much research that talks about the negative effects on health and well-being and how it exacerbates dementia and Alzheimer's and and the mortality risks. There's so much research. So I guess highlighting that and prioritizing it. Funding is a big issue. We don't fund aged care enough in Australia, even though we are one of the biggest users in OECD countries. We spend proportionately less of our GDP than other countries on aged care. Jane, did you want to jump in?
Yeah. I mean, I agree with Jasmine that I think, just getting back to your very first point, Nick, that there's no real kind of almost like science here. And I think that's what we've been trying to do, is like pull across all of the disparate material about social connection that uses all these different words and it's super confusing, and kind of try and pull it together, as Jasmine said, into like highlighting what are the key things that can help to accelerate social connection. But and I also think, you know, staff are a big issue here too, right? Because the staff also are often just cycling through these facilities and like actually paying some attention to staff, giving staff some training about these topics. Again, in Jasmine's research, she found that staff were super excited about learning this stuff because they have some frameworks to use, so they can understand what it is they need to do, what the benefits are, how to actually see progress, and that kind of thing. But I suppose that also I think we can see a bit of brightness at the end of the tunnel if we're looking for that, because of the providers that we have been working with who are kind of identifying that this kind of model of just giving a set number of things to do and saying, right, take it or leave it, they themselves are identifying that that model is outdated. It's not what is good for people or healthy for people, and they themselves are much more interested now in finding out what is the range of things that people want to do, and how do you kind of cluster people together to do these things together, and how can you facilitate that kind of thing to happen. But I guess at the end of the day, like everything happens in these kinds of businesses, whether they be run by non-profits or commercial businesses, by policy drivers. And so the policy drivers have to be there, which are that, you know, these facilities need to be rewarded for these things. So they need to be rewarded for people having social connection. And I guess that means that we have to have better indicators of what social connection is and measuring outcomes better, but also, you know, like I guess that they need to give their staff training needs to become a kind of indicator and that kind of thing. So yeah, we need to kind of give policy. I think people like me and Jazz, we need to give policy the tools that make it something that's doable. So we need to go from this kind of like amorphousness, like, oh, it's a good thing, blah, 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 to actually go, yeah, and here are the tools, here's what you need. And then there's a persuasion job with, I guess, with older people's advocates, but also with the sector. And then, you know, get this into policy, get it into like contracting and these risk frameworks and all of that kind of thing, because that's what will ultimately make the change happen.
And there's a hunger for this. Sorry, Nick. There's a hunger from aged care providers. Like it was both Uniting and Salvos that came to us wanting to know how to make improvements in this area. And we've heard that other aged care providers are out there looking for tools as well for social connection. So
where would people, and just to wrap up, where would people find the required resources, tools to understand, to, as your recommendation, Jasmine, learn more about the space, understand the different perspectives, and then perhaps work with you or come up with something to actually help solve this social isolation problem within the aged care space, at least within Australia?
Yeah. Well, I guess speaking to us about it, because we have created a tool. So the social connection assessment tool, it's 3 different sections. So the first section covers individual connections. The second section covers the activities and the ways that people like connecting with others. And then the third section covers the spaces and places in the facility that they like connecting with others or in the local community. So I feel like one of the first steps is really understanding how a person likes to connect, what their connections are already, so that you can build upon them to support them. So yeah, in a more personalized, person-centered approach, because aged care kind of talks about this person-centered approach that is meant to replace this outdated system, but that doesn't seem to apply for people's social and emotional well-being yet.
So is there any resources that they can read now or after this podcast?
Yeah, I mean, we have, I think, all told, it's a journey. We're on a journey, right? And so we have produced a resource that's available free on the internet called Social Connection 101. People could just Google it or whatever. It's kind of a practice-oriented collation of the evidence about social connection. And what we've been doing since we produced that material is work with different kinds of partners, not always in aged care, like in commercial organizations and with social prescribing kind of initiatives. And the idea has been to go, okay, how does this apply then? Right. How can we apply this and make this contextually relevant to what you guys want to use it for? Because it's like a stock cube, if you like, of the evidence about social connection that is converted to kind of normal speak. But now what it needs to do is kind of be converted into resources for actual contextual situations. And then I guess as we're doing more widely is kind of getting other research funding to just kind of understand the context better as well, more broadly, like we're doing in our kind of Australian Research Council funded research about social connection. So I think we'd be really keen to hear from anyone else who's interested in working with us on this.
And other aged care providers, because it's really the Salvos and Uniting who are competitors, essentially, that they're willing to work together to create this tool, and they want it to be widely disseminated amongst the sector so that, so they're happy to collaborate. So we would be happy to collaborate as well with other aged care providers.